The presidential declaration that sparks celebration, confusion, and anger, depending on who you asked.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
And ever since Biden uttered those words, the medical community and beyond has been debating. The president later clarified his statement slightly, saying the pandemic is no longer where it was. And the next day, his chief medical advisor, Anthony Fauci, was even more cautious in his assessment.
We are not where we need to be if we're going to be able to, quote, live with the virus, because we know we're not going to eradicate it.
Right now, the daily average for new cases is over 54,000. That's just the people reporting their cases. There are around 400 deaths per day. New hospitalizations are hovering over 4,000. And the only underwhelming number, not even 35% of people who are eligible for a booster have gotten at least one. I'm joined now by William Hanage, Associate Professor of Epidemiology at Harvard's Chan School of Public Health and a member of the school's Center for Communicable Disease Dynamics. Dr. Megan Ranney is an emergency physician, academic dean of the Brown University School of Public Health. Welcome to both of you. Thanks for being here.
Thanks for having us.
Dr. Ranney, starting with you, is Joe Biden right? Is the pandemic over?
I wish he were right, but both as an emergency physician and a public health professional, I know, unfortunately, that the pandemic is still going on. Listen, we are absolutely in a different phase. Our lived experience is different from it was 6 months ago, much less a year or 2 years ago, thanks to vaccines, boosters, improvements in treatment, and improved ventilation. But the reality is there are still a lot of folks who are getting sick every day, a lot of folks who are dying. And the World Health Organization itself is still quite clear that we are in the midst of a pandemic.
Bill
I'll
Hanage,
tell you
I'm sorry, go ahead,
yeah.
Doctor, I'm sorry.
My biggest fear about this statement is that it's going to dissuade folks from taking those preventive measures, from getting those new boosters, from masking during a surge, and therefore will prolong the pandemic phase beyond where it needs to go.
Which side are you on, Bill Hanage?
Well, Jim, I think I'm going to echo a lot of what we just heard. I mean, the thing is, we're nowhere near 2021, and we're not even near 2020, but that doesn't mean we're in 2019 yet. We still have excess respiratory illness, excess deaths, and even now at a point when things have been plateauing better than they have for quite a long time. Yeah, it's nowhere like the earlier stages of the pandemic. We are still struggling to get people the help that they need, and we can expect things to get worse in the winter months because you know what they've done the last few winters? They've been worse.
You know, and by the way, the 400 a day, well, I find that to be intolerable. Just to do the math for the mathematically challenged at home, it's 150,000 people a year dying from this disease, even at this point. I won't spend time with you talking about the what I consider to be the political mistake the president made. People like Senator Cornyn from Texas, who is obviously a senior Republican, says, if this is over, then I wouldn't suspect they need any more money, even though the White House is requesting billions. I want to go back to what you said, Dr. Ranney, and just show the audience a few statistics. First booster doses in the United States of overall population, this is 5 and over, 35%. The percentage of eligible kids under 5, 7%. What do you say to a patient who has been a skeptic so far, who walks into your office and says, Joe Biden says this is over. I wasn't going to get it last week. I sure as hell am not going to get it this week.
So I talked to them about the fact that I am still seeing COVID cases on a daily basis in the emergency department. We are still admitting patients with COVID cases to the hospital. And the big thing that we know makes a difference is that booster. I also talk about how the new booster is new and improved. It is updated for these new variants. You know, for the first time since 2020, we have a shot that matches the variants that are out there, and how exciting that is. And the best I can do is to talk them through their fears and talk about the benefits. And a percentage go and get the shot, but not all.
But it's a harder nut to crack after the comment from the president on Sunday night, Dr. Ranney, is it not?
That is right. I think it's a harder nut to crack on the individual patient level, on the community level, and on the political level, as you mentioned.
So, Bill Hanage, what is the criterion for you that would cause you to say the words the president uttered the pandemic is over? What has to happen?
Well, unfortunately, pandemics don't end with a bang and a ticker tape parade or anything like that. And that's what I've been telling people for the last few years. So for me, I think it's when we start seeing levels of background illness, which are more tolerable than they are right now. In some ways, it's pretty good that the president entered this conversation, because at some point we are going to continue to be seeing a certain amount of disease and death, which we are going to have to start dealing with and consider tolerable. But I just don't think that where we are now is where we want to be. There are still folks out there who need boosters. There are still folks out there struggling to access Paxlovid, Evusheld, and other therapies which are effective. So we should be looking to help those people, because that's what we need to do to take this and really turn it beyond the pandemic phase.
Dr. Ranney, do you have a different criterion?
No, the criteria really is that we're seeing surges in certain populations. And for a pandemic, it's that we're seeing those surges across the globe. So I'll add on, not only do we need to get folks vaccinated and boosted here in the United States, but we also have an obligation to our sister and brother countries across the world to help them get vaccinated as well.
Dr. Ranney, staying with you for a minute, there was an interesting juxtaposition in the Washington Post on Monday. There was the editorial, which was where you two are, and there was Dr. Lena Wen, who was the former health commissioner for Baltimore, saying he's right, it is over. Her argument seemed to me to be it's over because the public says it's over. And I think that was pretty much what Joe Biden was saying when he said, well, you don't see anybody wearing a mask. Isn't there something to that when so much of the public has been concerned that the public health world, you two and others, have been ahead of them on these things, that maybe it makes some sense to go where the public is, if you understand my question?
Absolutely. And that's why I start by acknowledging that we are in a different phase. We absolutely, on the part of myself, my kids, my parents, my community, we are living life differently from how we did a year ago. And that to me is the goal of public health, is for us to set up systems so that people can go about their daily business, stay healthy without even thinking about it. The trouble is that word pandemic has very specific implications in the public health as well as in the policy world. So yes, for the average person, the world is different. That doesn't mean that we've met the criteria for a pandemic to be over.
Bill Hanage, is the reason why the public, and by the way, I don't have hard data in front of me, it's anecdotal, but I think I'm right in what I just said to Dr. Ranney, is the reason why the public and you, and I think the majority of people in your world, are in different places because the messaging has been weak, for lack of a better expression, or conflicting through the last couple of years?
Well, I think partially it's actually just perception. I mean, one of the things I've always been aware of from the very start of it is that for people like me who talk to folks who are saying things like, oh my God, we ran out of ICU nurses last night, and who are readily, really in the thick of it, we've known for the last few years how bad this is. But for ordinary folks, it kind of has receded. The number you put out there, 150,000 deaths in a year, that's 3 bad flu seasons. But most folks don't remember when the last bad flu season was. And so I think that the general public can be understood for thinking about it in a different light.
I want to stay on messaging just for a second, Dr. Ranney. I played for you a minute ago Dr. Fauci saying something different. And there's a guy you just may know that has some connection to your school, who was the lead COVID officer for the United States of America. He was a frequent guest on this show before he was promoted. Here is Ashish Jha, Dr. Jha. This is admittedly 2 weeks before yesterday, but nevertheless, only 2 weeks. Here he is.
The pandemic isn't over, and we will remain vigilant. And of course, we will continue to look for and prepare for unforeseen twists and turns.
For those, by the way, not on the inside, he is the, I guess, on leave dean of the School of Public Health at Brown. That, what I would argue, conflicting messaging reached epic proportions during the Trump administration. But even with serious professionals in the Biden administration, when you have Jha here, Fauci here, and Biden here, that's not good for public messaging, is it?
It's a little challenging. The good side here is that Biden did acknowledge that COVID is very much amongst us still, and that we still have to fight against it. It's not that he was saying mission accomplished or that COVID is over. And HHS Secretary Becerra has backed that up in the last couple of days as well. Again, this gets to me to that difference between the public health world's language, those specific meanings of what a pandemic is, and the larger world's experience. We want the world to experience regular life. That's the goal. At the same time, our goal in healthcare and public health is to prevent unnecessary suffering and death. And as my dean, Ja, said, to stay vigilant.
You know, before you go, one last thing. The public health experts like you, with whom I spoke pretty regularly, especially in the first year of the pandemic, starting with Bill Hanage, would say the only bright spot, and I'm paraphrasing, in this carnage that we are living through is we're going to learn a lot of lessons. People in positions of power, real people on the ground, are going to learn how important it is to have an affirmative, fully funded, endorsed public health system. At least from where I sit, we've learned virtually nothing. Is that an unfair characterization of where we are in September of 2022?
I think it's a little unfair for some of the people who are in positions of power. I know some of them have come to realize that it matters a lot to take action earlier rather than later. But in general, as you can see from somewhat tardy responses to monkeypox and indeed polio, we still have a lot to learn. When it comes to the end of pandemics, though, I want to close by pointing out that in 1918-19, we think of there as being 3 waves. This was the really big flu pandemic in the early 20th century. In fact, excess deaths continued for a considerable period of time after that. We just label the first 3 waves as being the pandemic. And I think we're in a similar position right now here.
That was 1917, as Donald Trump called it, Bill Hanage. Dr. Ranney, final word from you on whether we've learned lessons.
I think we've learned some lessons, but not enough. If I take off my public health hat and put on my emergency physician hat, I can say that one of my hopes early in the pandemic was that we would understand the importance of adequately funding and supporting the emergency care system. And I can say that when I show up in my ER on a Thursday or Friday night, things are worse than they've ever been. Staffing are at lower levels, burnout is higher, patient volume is, we're bursting through the seams of our waiting rooms across New England and across the country. I would love nothing more than to see us make sure that folks have access to emergency and inpatient care when and where they need it. I'm not sure that we've learned that lesson at all.
Megan Ranney, Bill Hanage, thank you much for your work and your time. Really appreciate it.
Thank you.